How to improve kidney function naturally. Our kidneys are natural filters, removing harmful waste material from your bloodstream and balancing your body's fluids. In most people, a healthful, balanced diet will keep the kidneys working smoothly. Medical conditions like diabetes and high blood pressure, however, may compromise your kidneys' health and require you to make dietary changes. Identifying foods and beverages that contribute to optimal kidney health may boost their function, but be sure to ask your doctor or dietitian about the best regimen for your specific needs. If you drink more fluids, it is said increasing kidney function, but always more is not advised for kidney patients. You need take fluid to keep your urine either light yellow or colorless. A standard recommendation is 13 cups daily for men and 9 for women. Even your doctors will suggest not drink much water so that you don't overwhelm your kidneys. Many people who suffer obesity, autoimmune disease or urinary tract infections, UTIs, may also develop kidney disease within their lifetime. Any strain in body may lead to kidney problems. Common signs of kidney problems include frequent urination, problems urinating, pain, burning, or constant thirst. Western diets tend to provide too much sodium. Your kidneys use the process of osmosis, employing a delicate balance of sodium and potassium, to draw excess water out of your blood. When your sodium or potassium levels are too high, it can disrupt the osmosis process. Surgery is not always needed for kidney patients. Sometimes all you need are natural food remedies to help break up and dissolve the kidney stones so you can be pain-free and happy and healthy again. An overall healthy diet that includes plenty of fruits and vegetables is a smart choice for keeping your kidneys in top-notch shape. Fresh produce is not only high in water content, but it also contains powerful nutrients like vitamin C and flavonoids that support the health of all your organs, including the kidneys. If your doctor advises a low-potassium diet for your kidney health, focus on fruits and veggies that are significantly lower in this mineral. Your best veggie options are cabbage, cauliflower, red peppers, celery, asparagus, cucumber, eggplant, beans. You should avoid seasoning your vegetables, salads, with salt and salt substitutes and opt for dried or fresh herbs, mint leaves, lemon, chopped garlic, onion and just small drop of olive oil. Very important things is you stick to particular sizes, quantity if you like also, because too much of anything may lead lot of potassium. Depending your body weight you need to maintain your water balance in body. Water helps flush out toxins that can lead to bacterial infection or kidney stones, along with harmful particles in the blood. Basic is 6 to 8 glasses in entire day. Water is more to keep yourself active. Water is best cleanser among all. Patient should always opt for warm water always. Cabbage. An inexpensive treat as well as low in potassium levels. Cabbage can improve CKD patients' heart health as well as protect against lung, colon, breast, bladder, ovarian and prostate cancers. Limit sodium. You should limit salt intake as much as possible. In a day 3 to 4 grams salt is enough to keep yourself active. Always read food labels and see if any hidden sodium is there. Avoid foods that list salt, sodium, or monosodium glutamate message on the label. Buy foods that are labeled no salt added, sodium free, or low sodium. Foods labeled reduced sodium and light sodium may still have too much sodium. Avoid salted snacks such as pretzels, chips, and popcorn. Avoid smoked, cured, salted, and canned meat, fish, and poultry. This includes ham, bacon, hot dogs, and luncheon meats. Don't use a salt substitute or light salt unless your doctor or dietitian says it is okay. Most salt substitutes and light salts are high in potassium. Use lemon, herbs, and other spices to flavor your meals. Limit how often you eat food from restaurants. Most of the sodium we eat is hidden in processed foods and restaurant food, especially at fast food and takeout places. Agatha leaves. This green leaves, you can call as sesbane, corkwood tree, hummingbird tree, is mostly available in everywhere and should be consumed once in month. This herbs is bitter in taste with cold potency hard. You can boil it and grind it and make soup or gravy veggies. It purifies blood and flush all toxins from kidney and entire body. You have to take in small quantity else it may cause stomachache. It balances kapha and pitta in body. Cranberry juice. Cranberry juice is very effective superstar fruit for arteries, kidney, digestive tract, but you go only fruit juice and water-based juice, no milk and sugar in milk. It will help in flushing toxins from body and kidney. If juices are difficult, you can eat fresh cranberries. They are filled with excellent sources of vitamin C, antioxidants, fiber, and again, very low in sugar. These berries have special urinary tract benefits since they prevent ulcers and bacteria from developing and even fight current ulcers bacteria in the kidneys and digestive tract. You can add to food, breakfast, oatmeal, smoothies, whole grain porridge, salads for fresh tart taste. Green beans. Green beans contain carotenoid and flavonoid which have strong anti-inflammation properties. Kidney disease results from inflammation in the kidneys, so eating green beans can benefit kidney disease patients. It gives strength in our body and stimulate a regular urine flow, which in turn helps the body to remove toxins from the body. If patients are having stones stuck, will break down into pieces and flush through urination. Important thing is you should have in moderate quantity, else it worse your health due to excess protein and then excess urination. You can cut beans in small pieces and boil it and add a drop of oil for seasoning, and can add some coconut or onion or garlic and very little pinch of salt for taste. Kidney beans. Kidney beans provide many of the nutritional qualities that promote kidney health. They contain lots of soluble and insoluble fiber and are low in fat, which enhances cardiovascular health and helps keep your blood pressure low. The high fiber in kidney beans also helps to stabilize your blood sugar. Kidney beans are low in sodium, sugar and cholesterol, and they are an excellent source of low-fat protein. For a vegetable source, kidney beans provide a wide range of amino acids. A 3.5 ounces serving of kidney beans contains almost 9 grams of fiber, which is required in entire day. Kidney beans contain phosphorus, potassium, protein and magnesium. The kidneys filter out dietary excesses, so nutrients that are necessary for normal functioning, and which don't create an undue burden on kidneys for those who have normal kidney function, can create problems for those with kidney disease. Red bell peppers. Red bell peppers are one of the best lower potassium fruits to choose and are a good source of protective vitamin C. They also contain a good amount of lycopene, an antioxidant that helps ward off certain types of cancers in individuals with a healthy diet. Normally potassium is promoted as a healthy ingredient for people to consume because it flushes out the kidneys and eliminates water from the body. However, for those with kidney disease, potassium can make thirst and frequent urination worse because the bladder empties too often. But red bell pepper is with low potassium vegetables. Vitamin diet. Vitamin D is important mineral for good kidney health, and mushrooms are best whole food, plant-based source. Vitamin D has been found to regulate kidney function and may help prevent kidney disease. Fortified soy milk and almond milk may be other good options. However, make sure the potassium content isn't over 200–300 milligrams if you have kidney disease. Apples are another lower potassium fruit that also aid as a natural cleanser for the body. They'll still keep your kidneys cleansed without causing too frequent urination. Apples are another source of protective vitamin C, as well as the antioxidant quercetin, tied to heart health and cancer prevention. They're also a great source of pectin, a type of soluble fiber that's wonderful for diabetics since it slows down the blood sugar and removes excess cholesterol. Oatmeal. Though oatmeal is higher in potassium than some other grains, it's also lower than many fruits and vegetables. Oats are particularly a good source of iron and vitamin B6, which have both been found to be an important nutrient for preventing kidney stones and preventing nutrient depletion for those with CKD. Kale. Kale is a good source of vitamin A and C to prevent inflammation, protect the immune system. It's also lower in potassium than some other vegetables and greens and contains a large amount of iron. Iron is important for healthy kidney function since many people with kidney disease have an iron deficiency. In week 5 days try to have green leafy vegetables. If doctor have restricted potassium, then you have to take very small quantity. Spinach. This leafy green vegetable is high in vitamins A, C, K and folate. The beta-carotene found in spinach is important for boosting your immune system health and protecting your vision. It is also a good source of magnesium. Instead of lettuce in your salad, try spinach. You can also easily incorporate spinach into your diet by making a simple side dish of steamed spinach, spiced up with garlic and olive oil. If doctor have restricted potassium, then you have to take very small quantity. High protein diets should be avoided, especially if they're sourced from animal-based foods. It's also advised to reduce your intake of foods rich in phosphorus if you have kidney disease. Animal foods contribute to inflammation, while high phosphorus containing foods can cause kidney stones. If you don't have CKD and have trouble urinating, add a few more potassium-rich foods to your meals instead of reducing potassium in your diet. Potassium is rich in fruits, vegetables, and even some whole grains, nuts, and seeds. A moderate amount of protein of 40 to 50 grams can be consumed for kidney patients. 1 or 2 vegetables and fruits at each meal is must for overall kidney function and body balance. You need to avoid meat, dairy product, eggs, alcohol to avoid worst situation. Steamed, boiled, fully cooked food, baked food will be best for kidney patient. Avoid deep fry foods. You need to also control on phosphorus along with sodium and potassium. You have fresh, boiled vegetables, fruits like pears, peaches, watermelon, red and purple grapes, green tea, string beans, celery, cabbage, cauliflower, garlic, onions and all type of green leafy vegetables. In oil use olive or coconut oils, but everything in small quantity. If you are not kidney patient and just want to eat healthy diets to keep yourself healthy, be sure to eat variety of fruits, vegetables, beans, legumes, whole grains, nuts and seeds to get balance of both potassium-rich and moderate potassium-containing foods. A whole foods-based plant-based lifestyle is rich in anti-inflammatory proteins that are less likely to cause inflammation or acidity within the body and will ensure good heart health and healthy blood sugar levels. Your kidneys are one of your body's biggest natural detox components. Be sure you don't neglect them so they can keep you healthy and feeling great. Don't skip meals or go for many hours without eating. If you don't feel very hungry, try to eat 4 or 5 small meals instead of 1 or 2 big meals. If you have trouble keeping your weight up, talk to your doctor or dietitian about ways you can add calories to your diet. Healthy fats such as olive or canola oil may be good choices. Unless you have diabetes, you can use honey and sugar to add calories and increase energy.